Good morning, Georgia.
Good morning.
You are looking good.
Thank you. Thank you very much.
Recovery is good. Recovery is good, isn't it?
Yeah.
I can hardly believe. So they say, am I dreaming? Which myself. I think about times when I couldn't get out of bed. I think about times when I was held captive on a psychiatry inpatient ward. I think about times when I couldn't follow or track a conversation, or keep up a relationship, or even consider going to work, much less keeping a job. And I'm here this morning, and you are here this morning, and every person in this auditorium can think about times when they weren't as bright-eyed and bushy-tailed as you all are today. And yet here we are. So, James, what do I press on to get started? My name is Jana Spalding, and I won't say how many years ago, but many years ago, I was born just so that I could be here with you today. And I am so grateful. It's difficult to put it in words, and I'm one who does like to use the words. It's difficult to put it in words, but I'm so grateful for recovery.
Hey.
I'm so grateful to be able to say that I am a spirit being having a human experience. And all of us are spirit beings having human experiences. But in order to be in this realm where we live on this planet, it kind of helps to have bodies. Because otherwise we'd be kind of, floating. I don't know what spirits do if they don't have bodies. But we can travel around in these earth suits we call bodies and move from one place to another. We can talk to each other and relate to each other and take care of each other in these earth suits we have called bodies. We can move around because we have these bodies. And it's kind of interesting that we then put clothes on top of these bodies and put these bodies with clothes in other forms of transport to move around, to fly, to ride. And sometimes these earth suits don't quite function the way we would like them to function, so that we can move around and relate to other people and do the things we want to do. So my earth suit was really run down for a number of years. And then I had not one or two or three, but several earth suit failures. And I didn't quite understand what was happening. Now, my early story was a little different than Alicia's. And it just goes to show that our human experiences are all varied, but they all kind of lead us to the same place. So I grew up in a wonderful family. I had the opportunity from a very early age to have great education afforded me. Besides the fact that I'm one of those people that just likes to learn because I like to learn. Is anyone here like that? I mean, you just like to learn. And there may not necessarily be a practical use for a thing, but I just kind of go, oh, now that is cool. I love that. So I did learn, and I did go to school a lot. And my earth suit still failed. Just going to show that we don't always get to do what we want. And these earth suits are just really fragile. So yeah, that MD means medical doctor. But then after the MD, you see CPSS, and I currently live in Arizona, and that stands for Certified Peer Support Specialist. And then you all know what ITE stands for, right? What is ITE? So, in order of importance, the last title is the most important one.
All right.
I stand here today as one more example, one more evidence of the fact that education and good fortune don't protect us from hardship. But hardship doesn't have to define us. We have recovery. My MD did not keep the monsters away.
All right.
But it wasn't really medicine that returned me to wellness,
All right.
although medicine was a part of it. I was able to start on the road of getting better because there was a place where people did peer support. I actually believed what the doctors told me, which was that I was sick and would not be better. I believed that for many years. Thank you so much. And then I started hanging around and going to these support groups. And I looked around and there were people who had challenges and were living much better and fuller lives than I was. And from them, I learned what recovery was. From them, I learned the power of support. So this journey started back in the 1990s for me. And your organization, the Georgia Mental Health Consumer Network, played actually a very, very radical role in my own personal recovery.
All right.
And I want to make sure, I don't know if Sherry and Larry remember, but I remember like it was yesterday. It was in 2005 in Pensacola, Florida. The first peer training that I was aware of in the state of Florida. I lived in Florida at that time. Clint Rayner worked with a managed care company whose name I can't remember right now. And Ike Powell and Larry and Sherry and Lisa Goodell from PBSA trained a group of us in Pensacola Beach. I had already been working in peer support, you know, on the job training like it was in the early days before we had all this wonderful education. And we had a week in a little motel where we spent 8 hours at least every day going through this training. And my life was never the same. And let me tell you, just not even 10 years later, 9 years later, to be at a meeting and have Sherry come and say, Jana, would you come and speak with us? I'm one who likes to talk, but there are not always words that can explain. Just the sheer joy of it all, just the sheer joy of thinking back to when I could barely lift up my head and coming to today where I can share with you. And I've lived in a lot of places in this country. I've lived in Florida, I've lived in New York, I've lived in California, I now live in Arizona. In general, when one thinks about states that are at the forefront in general, in those places where I've lived, Georgia doesn't necessarily have the #1 role. You know, when I'm talking to people in Florida or in California or in Arizona about where are the happening places and where, you know, who are the people who have it together, it's not usually Georgia that people talk about. But when I think about peer support, I think about the first state where peer support was made reimbursable by Medicaid. And where was that?
Georgia!
And when I think about the state that really has been in the forefront of training peer specialists all around this country, I think about Georgia. And when I think about consumers who organize and who advocate for themselves and who cause changes in their local communities and who are a force to be reckoned with. The Georgia Mental Health Consumer Network is a force. Don't ever let anyone ever put Georgia down. Because I tell you that personally, I'm standing here today as someone who has only visited in Georgia, but whose life is immeasurably richer because of the work that the people in this room have done and continue to do. So, I do have a presentation. There is a PowerPoint. And, you know, like I said, I like to learn. And one of the things that I've been learning lately is that there are two ways to learn. And this presentation really talks about a different way of learning than the way we usually learn. Usually we learn by looking at what has happened in the past and using what has happened in the past in order to go forward. That's usually how we learn. But there's a new sort of paradigm that I've been learning about lately, where one cultivates some habits of being still and trying to get to the heart of why one does what one does, why people do what they do, why groups function the way they do. And if there needs to be a change, not just a change on the surface, but to find out at the core, why are we motivated to do the things that we do? And if something needs to change, have that change come from that core, as opposed to just having be a superficial thing. And one practices habits of stillness to find this, and then one makes a small change. You know, they say if you want to move a mountain, start by moving a few small stones. So if I get quiet enough to where I find out what's really motivating me, what's empowering me, what makes me when I get up in the morning want to do something, and if that has to change, well, what really is it that's changing? And I say, you know, I'm going to spend 10 minutes in the morning and 10 minutes in the evening meditating. That's all I'm going to do. So a small change like that, when we do it consistently and you look back in a month and 6 months and a year, you find that your life has taken a completely different trajectory. This idea is learning from a different place. And it's really based on this idea that the whole notion of looking from the future has come around. And so I hope it becomes clear as we get into the presentation. So I'm talking about a look from the future. We know what peer support looks like right now. We know what it looked like, some of us, 5 years ago, 10 years ago, even longer. But what will it look like in the year 2020? What will it look like in the year 2024? And if we can get still enough for a little while to imagine how we would like it to look, what we would like to see, how our work could be in those years, then we can take some steps today to get ready for that. And that's what this presentation is about. So I'm going right to the heart of the matter. A lot of what we do has to do with power. What is she talking about? Well, when I was sick, people treated me and helped me, but they also locked me up. And they also told me what I could and couldn't do. And I felt I had no power. And part of getting better is reclaiming that power so that you are determining what you do and not someone else. And some of what we do and some of the conflicts we have in our daily work have to do with power. And so we are in a power struggle. And I wonder what that will look like 10 years from now, 20 years from now, what will be the power dynamic? Will we still be having to prove ourselves every day, in every position? Will we be looking at our coworkers and supervisors and having to claw our way into supervisory positions or administrative positions? Or will it just be accepted and acceptable? So we're going to look at what roles peers can play in our systems and the impact that we can have on health outcomes. And there will be a shift in power. And I don't know about you, but I kind of like this notion. It's not the most profound definition, but I like the definition of doing what you like, being freedom. And ultimately, isn't that what we want? Ultimately, isn't that what we want? At all levels, you know, individually, as groups, whether it has to do with what we do with work, whether it has to do with how we are with each other, with where we live. This is what we would like. And we would like to be as free as we can be and not have other people or circumstances hold us back. So let me give you an idea of where I see us going. And I would like you to think about where you would like to be as a peer 10 years from now, 20 years from now. And paint that picture in your minds and keep that picture in your imaginations. So the magic of computers is such that I work on a Mac, and this slide is now being projected on a Windows-based program, so it cut out some of the words. If you were to look at the top of the slide, it would say, I see peace based on respect, not only in the Middle East, but even in Ferguson, Missouri. But I digress. I don't want to digress. I see levels and stages of peer support because there's room for everyone. And so I see certified peer specialists that work in all kinds of settings. And I see peers that are supervising peers. And I see peers that are running programs. And I see peers that are executives. And I see peers doing research. And I see peers teaching as faculty in universities. I see peers as advocates in our legislatures, locally and nationally. Anywhere where people are, I see peers. I see us getting paid better than we do. Because, you know, there's such a thing as a living wage, and there's nothing wrong with that. A living wage is a good thing. But making a living is even better than a living wage. And I would like this to be a way to make a good living. And please, please, please don't misunderstand me. There is value to where we all came from. I don't know about you, but I came from a time when this wasn't a profession and you couldn't make a living at it, and we all did it because that's how we survived, right? So if I knew somebody who needed help, I helped them. And to this day, that is how we do. That is how we live. Peer support is an extension of love.